Good morning. This public hearing conducted by the Committee on Appropriations and Adjudication will come to order. Notice of this public hearing was disseminated to all local media outlets via electronic format on May the 16th, with a second notice on May the 21st. Notice of the hearing was also made on the website. Actually, this is conducted in my capacity as sponsor of the resolution. It's Resolution 329, which is my third or fourth attempt at this, and it's self-explanatory. I'll have testimony, and then we can discuss. Peter Cruz. Okay, were you just in support or? Okay. Who wants to speak? Nobody? Whoever wants to come up, come up. Let's start with your boss, Mr. Gillum.
Thank you. Well, Speaker, I appreciate the opportunity. Yeah, I think for the third time to support this resolution, which falls on deaf ears every time it goes. It's part of that, I guess, the love-hate relationship we have with America sometimes. In some things they're very supportive, and others not so much. I support urging the Congress to sign this treaty. Otherwise, we can't do much about restricting access to tobacco products other than taxing. And I know you're considering raising the age again, and that's another matter for later. I was very disappointed. I was in Washington in February where we have our annual Association of State and Territorial Health Officials meeting, because it's an opportunity also to speak to representatives and senators. Of course, we don't have any of those, so it doesn't really matter to us. But we also get to visit with a lot of top federal agency people, and one of the groups was the Food and Drug Administration, which was very slow in getting their e-cigarette regulations out. 3 years after they said they were going to do it. But I had asked their tobacco lady, why this treaty hasn't been dealt with, and because she was just I think she's just counting the days until the administration changes. She just said, well, because nobody's brought it to the Congress to vote on it. And I reminded her that when President Obama was a senator, that he was pushing very hard for his colleagues to sign this convention, but noted that as soon as he made it to the Oval Office, that discussion just stopped. So I think we all know that big tobacco and big money talks, the whole idea about capitalism and free enterprise, and the fact that by implementing the framework that we could demand that advertising disappear from the windows of the mom and pop stores, that we could require plain packaging on tobacco products, that we could designate them to the rear of the structure somewhere. And until that treaty is signed, and probably never will be, I don't know what else we can do outside of spending more money on education, more projects that behavioral health and wellness does. We have had some impact, but now we're seeing, of course, a rise in young people using e-cigarettes, and we're going to have to deal with that eventually also. So I endorse it 100% every time you introduce it, and I admire you for your, what did I say, tenacity.
That's polite.
And no, I mean, and I think you don't mince any words in any of the resolutions, because I think it has to be said that we express a lot of frustration about, we can have some immediate effect on access to tobacco products if we could have this convention signed. But unfortunately, I don't think in our lifetime, and probably in our children's lifetimes, it's going to happen. Thank you.
Thank you very much. And I probably should, at least for the listening audience, read the title. It's relative to expressing I Liheslaturan Guåhan's unequivocal support for the United Nations World Health Organization Framework Convention on Tobacco Control in its efforts to address global tobacco epidemic, and to requesting that the Obama administration support the WHO and submit it to the U.S. Senate before the end of this year for ratification, and for further requesting the U.S. Senate to ratify the WHO Framework Convention for Tobacco Control. This document was prepared by the World Health Organization in
Long time.
It's been over 15 years. It's interesting that we have FESPAC here because of the 27 nations that are here for FESPAC. There are only 2 delegations that know of or have still see tobacco advertising in their stores, or have cigarette packages that aren't plain or don't have a photograph of a cancerous mouth or throat. Every single country in this region, save for Guam and CNMI, because we're both U.S. territories, have signed the Framework Convention for Tobacco Control, and all of them have been able to control tobacco, its dissemination, its sale, as a consequence. Unfortunately, being a U.S. territory, we can't do those kinds of things on our own separately. Or at least if we attempt to, there are responses of, you can't do this because of some perceived constitutional right to advertise and free speech to be able to put up whatever sign you want. But in every single country, and in the United Nations, there's 196 countries, and 180 have signed. And in this area, the only 2 countries that haven't signed it are the United States and Indonesia. Even China has signed the Framework Convention for Tobacco Control. China and both Koreas and Taiwan and Japan, who we think are the biggest smokers, they've signed the Framework Convention. But the United States, because of the tobacco lobby, cannot and will not do it. And for the listening audience, the reference made by Mr. Gillen was that in 2005, a young freshman senator from Illinois, Barack Obama, sent a letter to the then President Bush asking that President Bush send the Framework Convention for Tobacco Control to the Senate for ratification by himself and his colleagues. But he is now in his last 6 months of his administration, and this senator, now the lame duck president of the United States, is unwilling to do that. And it really is an impediment to all the efforts that are being made by public health and mental health to try to address tobacco, its addiction, and its consequent cost on health in our communities. But I will continue to be tenacious and try. So, Mr. Cruz.
Well, this is the second time I've sat before you. About 10 plus years ago, I had the opportunity to represent Guam in a World Health Organization FCTC regional meeting in Fiji. And you just kind of took all the information out of my speech there. But, yeah, there's all those little minute laws that FCTC has that really does bring down the rate of smoking in the areas. And one of the biggest battles in recent years is just what you had mentioned, the picture labeling on cigarette packs. Countries now have even gone to non-labeling at all. I mean, all you have is just a pack that has nothing on it in some countries, other than they know it's a pack of cigarettes, as far as advertisement, the health warnings and all. It is so important that you and we continue this fight, just because of the locale Guam is located. We are so close to the Far East Asia, where they are typically the biggest producers of tobacco products. And you can still go to any of the mom and pop stores and they're still selling black market cigarettes. And so it's so important that we do, if not part with the United States, just on our own accord as an island, continue to get on the bandwagon. And it's just a shame. You know, like you said, you can go to all these other islands and that are, you know, representing FESPAC, and their smoking levels are so much lower than Guam's. You know, we still have, just 2 years ago, CDC's 2014 has Guam as the highest rate of smoking in the nation. And I strongly, one of the points is because we are so close to the Asian countries, which typically has some of the highest rate of smokers. And so it's just a domino effect. You know, the health status of our people continue to break our island. It's a shame when I had spent two months from February to April at St. Luke's, Global City, and it's just so disheartening to see people go there with health issues that are tobacco related. There was even one gentleman who had a kidney transplant, and he would literally, several weeks after the operation, transplant, his wife was rolling him out to the right side of the entrance, because that's typically where the smoke area is, so he could have a smoke. And I just wanted to go up there and just say, look at and so please continue on the fight. Thank you.
Thank you. Thank you very much for coming down, Mr. Gillen. And we stand, does anybody else want to testify? If not, we stand adjourned.